Hey, do you have a newborn? It is important that you know how to clean your baby's umbilical stump. Proper care and hygiene is important in order to prevent infection. Hey, I'm Dr. Kristine Alba Kiat, and my mission is to empower you moms and dads so you can raise happy and healthy kids. In this video, we will talk about the umbilical stump. What is it? What are the steps to clean it? How frequent should you clean it? And more importantly, what are the signs of an infection? So what is the umbilical stump? After birth, your baby's umbilical cord is clamped and cut. The part that is attached to your baby is known as the stump, and it often comes with a clamp. In the first few days, the stump will get darker and then eventually will shrivel up and fall off to become your baby's belly button. This process may take 1 to 2 weeks. During the process of the stump drying up, there might be oozing, clear, sticky, brownish liquid that might leave a mark, and it might smell a bit, but it is the normal part of the healing process. So how do we clean your baby's umbilical stump? First, you need to wash your hands thoroughly before touching your baby's umbilical stump. And secondly, always remember to have soft hands, and a gentle touch is important. No forceful actions, please. What do you need? You need clean water, mild soap, some cotton swabs, and clean dry cloth. When you're ready to clean your baby's umbilical stump, the first step is to gently fold down your baby's diaper in order to expose the umbilical stump. Then, use cotton swabs or the clean cloth and you dampen it with warm water and mild soap. Next step, step 3, clean around the base of the stump. Then, step 4, rinse it by using a clean damp cloth to remove any soap residue. Then, step 5, pat the area dry. So it is advisable to keep your baby's stump clean and dry. And if your baby is ready for a bath, you can sponge bath the rest of your baby. But do not do tub bath as it is not advisable. You can only do tub bath and if the stump has completely fallen off. Also remember, do not pull on your baby's umbilical stump, even if it looks like it is ready to fall off. And keep the area clean and dry until the stump has completely healed. How often should you clean your baby's umbilical stump? Well, you can clean your baby's umbilical stump 2 to 3 times a day as directed by your pediatrician. You can do this whenever your child's stump has been stained by pee or poop. Some doctors recommend leaving the stump untouched and dry, which I do recommend as well. Now, what are the signs of an umbilical cord infection? Well, your baby's stump is infected when there is redness around the skin, when there is swelling, when you note foul odor, when there is discharge oozing from your baby's umbilical stump, or if your baby has a fever. It is important that you call your pediatrician because infection can spread quickly. Call your doctor right away when your baby has poor feeding, a fever of 38 degrees Celsius or 100.4 Fahrenheit or higher, when your baby is lethargic, and when there is poor muscle tone. So sometimes, instead of the cord completely drying up, the cord may form a pink scar tissue which we call an umbilical granuloma. This granuloma drains light yellow fluid. Don't worry though, it would go away in about a week. If not, you should let your doctor know about it. Also, if the cord has not fallen off in 4 weeks, let your doctor know as well. So some tips for you mom and dad for your baby's umbilical stump. First, use mild soap and water and clean just around your baby's umbilical stump. Number 2, keep the stump clean and dry. And number 3, use loose fitting clothes on your baby to prevent friction. Hey, if you like this video, watch my next video where I teach you about other child health problems.